Hello everyone, today we will be studying on the topic twin block appliance. So let's begin. The twin block technique effectively combines the inclined plane with intermaxillary and extraoral traction. The appliance consists of upper and a lower plate having occlusally inclined bite planes that induce favorably directed occlusal forces by causing a functional mandibular displacement. Simply, it consists of the upper and the lower plate that causes functional mandibular displacement. The upper plate is retained by modified arrowhead clasps. As we can see, the upper plate, there is modified arrowhead clasp. The clasp can incorporate a tube for the attachment of the face bow. The upper plate can also have the jack screw in the case maxillary arc expansion is required. The upper appliance consists of a bite block that covers the lingual cusp of the upper posterior teeth, extending anteriorly till the mesial ridge of the upper second premolar, extending upon the mesial ridge of the upper second premolar. The lower the lower plate is retained by the interdental ball clasp. The lower bite block extends distally up to the distal marginal ridge of the second premolar. As we can see, up to the distal marginal ridge of the lower second premolar. Now, the upper and the lower bite blocks interlock at 45-degree angle. Here, the upper and the lower are at 45-degree angulation. Now, the bite registration. The twin block appliance is constructed after a bite registration procedure. As described for the activator, the mandible is sagittally advanced by 5 to 7 millimeter. This mandible is sagittally advanced by 5 to 7 millimeter. And similarly, vertically the bite is opened by 3 to 5 millimeter in premolar region. Similarly, in the premolar region, there is opening of 3 to 5 millimeters. So this is how the bite registration is done. Now, the orthopedic traction. In the case the severe skeletal discrepancy, extraoral traction is used. That is, in the case the skeletal discrepancy is severe, the extraoral traction is used. The twin block appliances uses a concord face bow that combines the extraoral traction and intermaxillary traction. The face bow is unique as it has the curved labial hook. The face bow is attached to maxillary molars. The intermaxillary elastics can be used from the curved labial hook of the face bow to the mandible. The extraoral traction of 200 grams each side for 8 to 10 hours a day is prescribed. So, and the intermaxillary force of 150 grams is applied from the lower appliance to the labial hook of the concord face bow. Now, the fixed twin blocks. The twin block appliance may be designed for the direct fixation to the teeth by bonding. It resembles the Herbst. Okay, in the Herbst appliances also it is fixed, right? It resembles a Herbst appliance, substituting the occlusal inclined planes for the telescopic tubes. Here in the Herbst, telescopic tubes are present, and here the occlusal inclined planes are present to guide the mandible into a protrusive position. Okay, so now we know that the patient acceptance of the twin block is very good. Why? There are further reasons behind it. So following are the reasons for the patient's acceptance. The first reason is the bite plane offers great freedom of movement in anterior and lateral excursion than other functional appliances. There is freedom of movement. The first reason is freedom of movement. Similarly, the second is they offer the less interference with the normal function. So normal function is less interfered, hence there is good patient acceptance. The third is the significant changes in the patient appearance are seen in 2 to 3 months. That is, within 2 to 3 months, this short period of the time. Within this short period of the time, the significant changes in the patient's appearance are seen. Hence, it has good patient acceptance. So this is all about the twin block. This is the picture, and we talked about the introduction, byte registration, orthopedic tractions, fixed twin blocks, and patient's acceptance. This is all about